Hi, this is Clarissa with the Minnesota Research Link. We're meeting with Derrick Fritz again from Olmsted County. Last week, we talked about the community health needs assessment in Olmsted County. And today we're going to be discussing some of the rural outreach efforts that his team are working on. So can you reintroduce yourself?
Yeah, hi everybody. I'm Derrick Fritz here, housed within Olmsted County Public Health Services. I'm the Community Health Assessment and Planning, or CHAP coordinator. Been here for about a little under 2.5 years, and I help facilitate our community health needs assessment in our community health improvement plan processes.
Great, it's great to have you again. Can you describe some of your efforts for rural outreach?
Yeah, we've been really fortunate. Recently, back in April of this year, we received a grant through the Minnesota Department of Health, which is a rural health assessment grant. We received this grant to really specifically work on rural health and rural outreach here in Olmsted County. We're partnering with Diversity Council, which is a local nonprofit here in Olmsted County, to implement what's called a co-design process. And so Diversity Council is really taking the lead on this project management of this process. And really what co-design is it's a community engagement method with folks to be able to connect directly with individuals with lived experience, hear their stories, and then also be able to have them connect with other individuals in their community, and then come back as a group to be able to share their experiences as well. So it's really an inclusive, really cool engagement method. And ultimately our goal with this project and this rural outreach is to identify gaps that the residents in more of the rural parts of Olmsted County may experience in relation to their health, help develop and have them develop recommendations on how we can address our community health improvement plan priorities in these rural spaces. So mental health, drug use, and access to care. And then also being able to start to build and establish relationships with individuals and organizations in these rural spaces.
Well, that's wonderful to hear. Why did you guys decide it was important to reach out to rural populations specifically?
Yeah, I think one of the biggest reasons is just the amount of population and the individuals that live in those rural places here in Olmsted. If you're familiar with Olmsted County, we have Rochester, but we also have a widespread group of other small towns and cities. And in fact, about 25% of the overall county's population lives in more of these rural spaces. So being able to connect directly with these individuals who've had experience living in these rural spaces and are able to share their experience and learn, as we know that the rural experience around health and well-being is different than those in urban or more suburban places. So I think being able to learn from residents themselves is really important.
Yeah, absolutely. And how do you plan to reach out to the rural populations?
Yeah, through the co-design process that Diversity Council is leading us through, we've had the chance to start to recruit community connectors or co-designers. And so we have 5 individuals who have lived experience in Stewartville and Byron and these smaller towns in Olmsted County. And essentially in terms of being able to reach out, we reach out through these community connectors to have a conversation with them, and then ask them who are some of the organizations, who are some of the individuals or groups that live in these rural spaces that we can continue to have further conversation with as well.
Okay. And what have been some of the results for your outreach efforts? And I know it's new, so what are some of the anticipated results?
Yeah, appreciate the question. And like you said, we're still in the middle of these conversations. And so ultimately, the anticipated results will be to receive recommendations from the co-designers, those community connectors themselves, in terms of what can we do to address some of those community health priorities in more of the rural spaces. So I know that those recommendations we'll plan to have sometime early 2023 around the springtime. So really excited to be able to hear what people are thinking.
Great. Do you have anything you'd like to add that we haven't discussed?
I don't think so.
Okay. Well, thank you so much for meeting with us again. We really appreciate you taking the time.
Yeah, absolutely. Thank you.